Good morning. Thank you for coming to listen to me today. I realize you probably did not have a choice, but I promise there will be good stories and I will keep you awake and you will not fall asleep in this auditorium today. So I'm glad to be here. Teenagers are my absolute favorite people of all the people, and much of my career I've been lucky enough to take care of teenagers. I've worked in the intensive care unit, in the emergency department, and even in a psychiatric care department where we help teens learn to deal with anxiety and stress and depression. I've also worked with newborn babies and post-surgical patients. In any case, the majority of my career has been taking care of children. So I'm glad to be here today, and we're going to talk a little bit, actually a lot, about asthma. And feel free to raise your hand when you have a question or just call out. I want this to be an interactive experience for all of us. So what is asthma? And how do 300 million people worldwide suffer from asthma? Today it affects around 10% of adults and around 15% of children. So that's a lot of people. When you look around this auditorium, you can expect 10 to 15% of you to have asthma. Raise your hand if you do. I'm curious to see the numbers. Thank you. That looks like around 15% to me. So it's a big number of your classmates who struggle with asthma. So what is asthma and how do you know if you have it? People who have asthma have very typical symptoms. It doesn't vary too much. When asthma occurs, it results in coughing, wheezing, chest tightness, and shortness of breath. Well, we've all had a cough from time to time, but very few of us have experienced the fear that comes with chest tightness and shortness of breath. Wheezing, it's generally only heard with a stethoscope, but I can tell you, working in the intensive care unit, that I have heard wheezing. It sounds a little bit like a high-pitched whistle without my stethoscope in kids who are very, very sick, and that's a very scary sign. Well, what does it take for our body to make a wheeze or this sound of a whistle? Well, you need a smaller tube. In the case of our lungs, the tubes that lead to the lungs become constricted or have thicker mucus on them, so it actually is making that airway smaller. If I gave you the choice for the rest of this presentation to either breathe through a hose or a straw, which would you choose? I mean, of course, nobody wants to breathe through a straw, and I've been told that having an asthma attack feels a bit like that. You just can't get enough air in, and it's very difficult and frightening. But asthma, it varies a little bit in each person. Most medical professionals have determined that asthma can be labeled as mild, moderate, or even severe. The symptoms for each of these are a bit different, so we're going to explore a little more so we understand the levels of asthma. In a mild asthma attack, there may only be shortness of breath when you're moving or playing with activity. But with moderate asthma, it's difficult to do physical activity, but rest will make the symptoms better. In severe asthma, the shortness of breath continues even while resting. Sitting in a chair, it's difficult to breathe, and the person even has difficulty speaking. I hesitate to speak of life-threatening asthma because it is so rare, but a person experiencing life-threatening asthma is typically not even able to speak. So now that we understand a little bit more about what an asthma attack can look like, let's talk about the causes. So why? What causes 10 to 15% of us to have asthma? I'm going to break it down into two categories. First, we have endogenous. That's an internal cause or an origin, something that comes from within. And second, we have environmental causes. Both of these are difficult for us to control. But first, with the internal or endogenous factors, some people appear to have a very strong genetic predisposition to developing asthma. Their airways are more reactive. They even develop a hyperresponsiveness. And hyperresponsiveness is not something we want. It's not an attractive feature, especially in a bronchial tube, an airway that we want to stay open to allow you to breathe comfortably. Another endogenous factor, or internal factor, is gender. In the childhood years, twice as many boys as girls will develop asthma. So gender is a very strong predictor. But interestingly, by the time we all grow into adulthood, which will be in about 2 minutes for all of you, the ratio of men and women who have asthma ends up being about the same. Atopy. Now that's a word you don't hear thrown around very often, but atopy is a risk factor for asthma as well. It's a predisposition to developing hypersensitivity reactions. People who have atopy will also have seasonal allergies as well as eczema. So there is a strong genetic link with atopy and the reactions that it causes. Now let's think about some of our external factors. These are many and varied. They include everything from pollen, seasonal allergies, mold, dust mites, secondhand smoke, firsthand smoke, no one smokes, right? Respiratory infections, and even diet. These all play a role in the external factors that can cause an asthma reaction. So let's take a look more deeply at these internal and external factors and how they act as triggers. So triggers vary for each person. For you, you may have more asthma episodes in the spring when you're dealing with seasonal allergies. Or maybe you go to the high school dance and every girl that went to the dance put on a half a bottle of perfume. Okay, maybe all the boys put on a half a bottle of cologne. I don't want to single out either gender here, but the combination affects your airway and then the reaction begins. Another common trigger is a simple viral infection, like a common cold. It can easily cause an asthma reaction. Even exercise, you may have heard of exercise-induced asthma. For some, working out can cause that reaction. And for others, breathing very, very cold air can also cause an asthma attack. Interestingly, people who are obese are more likely to have asthma as well. At one time, I was working in a pediatric intensive care unit, and we had 3 children on the unit at the same time, and it was in the spring during seasonal allergies, and all 3 of these kids were struggling with asthma. In addition, all 3 of these 5-year-olds weighed more than 100 pounds apiece. So you can easily see how a seasonal allergy exacerbated the situation, caused an asthma attack, but in a child that is so small, so young, and so large from the obesity, it's very, very difficult to protect the airway. One of the more unique causes of asthma is stress. At times of stress, many people find that they're much more likely to have an asthma attack. And it's interesting, I often work in the adult and pediatric emergency department, and people will come in from time to time having a panic attack. Does anybody know what a panic attack feels like? Well, it mimics asthma. People feel short of breath, they have a tight chest, they have this feeling of impending doom. So that tells us again not to ever underestimate the link between our emotions and our health. For those who do have asthma, we highly recommend slowing breathing down, recognizing when stress gets high, and taking good care of mental and physical health to prevent those episodes. But in a quick review, we've looked at some of the causes of asthma, both internal and external, and then we've considered some of the common triggers, keeping in mind that triggers do vary for each person. Now let's look at some ways to prevent asthma from occurring in the first place. So prevention and lifestyle changes. That's what this is really about. Prevention is about changing and creating awareness. So many people who have asthma state that they do have some warning signs before an impending attack. Some people may have itching under the chin, or even pressure or discomfort in their upper back, and others will feel this inexplicable sense of impending doom. So these are things to pay very close attention to. But limiting triggers is going to help reduce the asthma episodes. And there are several tips that everybody who has asthma should follow. First, we'll get this one out of the way. Get your annual flu vaccine. You don't want to have flu that causes an asthma reaction. Avoid sickness at all costs. Wash your hands frequently. We nurses love to say that. I could not pass up a talk without talking about washing your hands. So wash your hands frequently will help you avoid viral illnesses like the common cold. Avoid smoke. cigarette smoke as well as bonfires, and even wood-burning stoves in homes. Find out your local pollution rates. These are easy to find out now. You can check on the internet. If you watch the news, daily they'll post the pollution rates in your area. If your pollution level, if the air quality is poor, stay inside as much as possible. Reduce your outdoor time on those days. If you have seasonal allergies, be proactive. Take your allergy medicine every day. Don't let it lapse and put yourself at risk. Stay inside more than normal. Keep your windows closed. There's many things that you can do to prevent the seasonal allergies. Also, mold. Mold is a real problem for people that struggle with asthma. Check around your leaky faucets, look in the shower, around the toilet. Any place that can be damp can grow mold, and many people who have asthma have an allergy to mold. So that is an area to definitely check and take care of. Several people with asthma also have allergies to dust mites and house dust. And a good way to prevent this is to vacuum frequently, but on the flip side, don't go into a room that has recently been vacuumed, and if at all possible, don't do the vacuuming yourself. Now you've got a good excuse not to vacuum the house. But if you do need to vacuum, you can wear a mask, but again, stay out of the room until the dust has settled. If you own pets, and this is near and dear to my heart, they should be kept outside. But that is not possible for a lot of people who love to share their lives with pets. So in that case, don't let your pet go in your bedroom, and keep your bedroom door closed. Whenever possible, people who have asthma should have the carpeting removed from their homes. If there's hardwood floors, enjoy those instead of the carpeting, and avoid buying furniture with fabric. When my son was small and he was struggling with asthma, we kept the pets in the house because that's the kind of people we are, but we were fortunate enough to live in a house that had hardwood floors. So we reduced the number of blankets that we had on our couches. Over time, we replaced our fabric couches to leather couches, and we even put away his small stuffed animals. Those little stuffed critters are an excellent place for holding on to dust and dust mites. In addition, we covered his mattresses and pillows with plastic covers to reduce the ability of the dust and dust mites. For the home in general, it's really useful to use high efficiency particulate air filters. These are HEPA filters, and they help lower the amount of allergens throughout the whole house. When you do wash linens and towels and rugs, things that are out in the home for everyone, be sure that you wash at very high heat. Up to 130 degrees will kill the dust mites. If your home has cockroaches, eliminate them as soon as possible. Simple ways to do this are to keep the garbage in an enclosed container and to set up traps. But again, many people who have asthma have an allergy to the droppings from the cockroaches. So we have addressed lifestyle changes and prevention techniques that can help the average asthma sufferer. But how do you know if you're effectively reducing or preventing an asthma episode? How can you monitor the effectiveness of your treatment plan? So it is very important to monitor the effectiveness of your plan. First of all, you can consider your plan to be under control when these 4 items are checked off. 1, you're sleeping all night and you're able to be active during the day. That's great quality of life. 2, you are free from wheezing, coughing, and shortness of breath. Again, you're feeling good. 3, you use fewer than 4 quick relief medicines every week. We're going to talk about medicines in a few minutes. And 4, you have an acceptable peak flow reading. What's a peak flow reading and how would I get that? So let's talk about that. It's a way where you can evaluate how well your lungs are moving air, and you use a peak flow meter. It looks a little bit like a harmonica, but you turn it the other way. And it's very simple and effective to use. You simply take a deep breath, filling your lungs fully. You hold your breath as you place the mouthpiece in your mouth and you close your lips around it. Don't put your tongue against or inside of the hole. And then you blow out as hard and as fast as you can in a single blow. This first burst of air is the most important. Blowing longer doesn't change the results. And then you write down the number you get. You do this 2 more times, and the highest of the 3 numbers is your peak flow number. And you'll write this down in your log chart. Everyone who has asthma should be assessing their peak flow as often as possible, at least daily, and especially on days where it's questionable if the air pollution is high, if the allergies are bothering you, if you were exposed to dust mites, whatever your trigger may be, it's a perfect time to check your peak flow to see if that is changing. There's a lot of children who are under 5 that have difficulty mastering that. You know, little kids under that age have a hard time blowing up balloons as well. Some of them are able to, but as soon as you can teach the younger children how to blow on the peak flow meter, will give the parents a very adequate and accurate way to measure the peak flow and the efficiency of the lungs. So completing the peak flow meter daily is an important measure of your lung function, and you and your doctor will stay in touch and plan what goal number is ideal for you. In addition to evaluating your peak flow and your cough and shortness of breath and any symptoms, you also need to take your daily medications. And this leads us right into treatment for asthma. Asthma is basically, there are 2 medication types. We have prevention and relief, or the preventer and the reliever. So preventers are taken daily, and you may have heard of some of these. These are simply inhaled corticosteroids. The common ones that you may have heard of or be familiar with are Pulmicort, Qvar, and Flovent. So these are long-acting medicines, and they help to reduce overall inflammation and mucus production in the airways. If you take these consistently and daily, these medications are very, very effective and the best option for reducing and preventing the occurrence of asthma. These preventer medications can also be called controllers because they help to control the inflammatory reaction, the mucus that we talked about, that is so common in asthma. However, if you do develop a cough, shortness of breath, wheezing, or chest tightness, then it's time for a reliever. The preventer isn't working, so you step up the game and take a reliever. The reliever is also an inhaler, and it's usually albuterol. So these reliever medications, they're short-acting, and so you may end up using them more than once. Albuterol quickly relaxes the airway muscles and allows the air to pass more easily. The tightness will be reduced as these muscles relax, and the size of the airway will return closer to normal, back to taking our straw-sized airway and making it larger to a more normal and comfortable size. At times, however, the airway can get irritated and doesn't effectively respond to the rescue medications or relievers. In this case, we're back to our mild, moderate, or severe. Are we able to talk while we're walking? Do we have to stop walking to talk? Do I have to even sit in a chair to be able to speak? So this is where we evaluate what level of asthma attack we're currently experiencing. If it is not manageable with the inhaled steroid or the inhaled albuterol, you must go to the emergency department for further evaluation. At times, additional medications may be required, and you may even need to stay in the hospital until you're improved. Typically, hospital treatment involves inhaled bronchodilators, increasing the size of the bronchial tubes, and either oral or even IV steroids, but it varies on the severity and how the asthma is functioning in that person. So are there any questions about the types of medications that we're using? To recap, remember that there's daily medications that are taken to help prevent inflammation, and then there's rescue meds that will help immediately open and relax the airway. So today we've talked a lot. I've talked a lot. Asthma is a complex topic. We've talked about the causes of asthma, how to prevent asthma with lifestyle changes, In addition, we looked at how to monitor if the treatment is working. Remember the flow meter and assessing our symptoms. And finally, we discussed the medical treatment based on long-term and short-term needs. Are there any further questions or anything that someone would like to share? Thank you so much for inviting me here today. Don't hesitate to contact me at any point in the future. I would love to speak about asthma or any other medical topics that apply to teenagers with any and all of you. Thank you.